You mentioned that you had a background. You knew about this work. You've done it before you started residency. But I will just take a second to talk about how I found this work. I, of course, am a pediatrician. And so when I talk about doing veteran disability work, I mean, people's eyebrows hit the ceiling. They are so surprised. And I will say I initially, of course, did not know. I think we talk about how there is such a need. The U.S. government mandates physicians, nurse practitioners, PAs now, but medical providers to do these exams, yet medical education is entirely silent about it. And probably 98% of physicians do not know that this is a tangible non-clinical option for all of us, regardless of specialty. If you have 2 letters, MD, DO behind your name, you are able to do this work in the United States. And listen, take it from me, a pediatrician. I did it. I do it. I really enjoy it. So I want all of the listeners who are listening to understand, you may be sitting back saying, oh no, I couldn't do that work. You absolutely can. So many of the veterans I see, I think in our minds, again, I did not have a military spouse. I had no military in my family. I did not know what this looked like. So when you say veteran disability, I assume it's amputees, blast injuries entirely. So I also would like to maybe debunk the types of things you see. Could you expound on what types of claims veterans are coming to you to see?
Yeah, so I will tell you, it's anything head to toe that happened to them while they were at work. You can think about it as the workman's comp of the military. However, it's not a good representation because that workman's comp is like an acute event. So if you understand it, that when somebody enters the military, they are the property of the government for 7 days, 24 hours of the day. So if they have to shave every single day and they get razor bumps, that is considered a condition that happened to them while they were active duty, right? So they can claim that. If they got, if they had to put their hair in a certain way, you see this a lot with females, they have to wear their hair in these buns that are really, 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 really tight, and they get traction alopecia. That is something they can claim. I mean, the list goes on and on. Mm-hmm. Of course, every musculoskeletal condition, post-acute and chronic, are things they can claim, even if it's a strain, even if it's something, that even from old age. I mean, you have veterans that are in the military until their mid 40s, late 50s. Things that they would have acquired, while they were civilian, they acquire these rapidly because they have to work and they have to be in certain situations, while they're active duty. And it makes me think about the career of medicine. Because I'm like, if we had something similar to that, right? We would all be claiming neck strains. Mm-hmm. We would all be claiming, right, carpal tunnel or whatever situations that we have, migraines, all the things. So it's very similar. The only thing is there's responsibility. The military takes responsibility of these now veterans or active duty service members for anything that happens to them while active duty. Even
that's right.
C-section scar.
That's right.
They have to wear uniforms. That gets irritated, right? Gestational diabetes. These are things that happen to them while they're active duty.
That's right.
Flat feet, plantar fasciitis,
right.
Migraine,
headaches, sinus infections,
everything. So that's why. Can you imagine?
Yes. I know that a lot of medical professionals, a lot of physicians are so curious about this work. And I'll quickly say, just how I started it. You and I reconnected. We both live in Southern California. I think when I first met you, maybe in 2015, I knew you were family medicine. A few years later, I saw you, we reconnected on LinkedIn. I saw all this veteran work and I thought, oh, what is this? I'm so interested. I'm sure it's not for me. I'm a pediatrician, but I had the idea for doctoring differently. I wanted to teach physicians about their options. I called you up. We spoke for an hour. And you were so excited and passionate about this work. And by the end, I thought, well, I'm doing some locums, I'm doing some per diem. I have a few things, but I have time to add something on. And within 6 weeks of our conversation, as I was seeing my first veterans at the beginning of 2021. And again, as a pediatrician, I walked in having not touched an adult in a clinical setting in close to 10 years. But I'd say within a month. I mean, you gave such great training, and I felt so supported. The veterans are so polite, of course. These are people, yes, ma'am, no, ma'am. I felt comfortable. I felt supported. And, within, I'd say 4 to 6 weeks, I walked in and thought, okay, yeah, I got this. I can do this. And I feel like it actually makes me.
And you did so well.
Well, thank you so much. But I feel like it also makes me a better doctor, a more well-rounded physician, a better pediatrician, actually. Just in that I have a broader sense. I feel like I can do anything. I can learn anything. And that's the most important part I always say to people is we are capable of learning new things. So, okay, now the moment. I want to hear about, your growth. You started a company, Veteran Medical Group. You train and support physicians as they enter this field. So how did that begin? How is it going? Give us a story.